Guys, today's Uganda Day. Very excited.
There is something powerful that happens when people come to Uganda. When they leave behind the routine of home, and step into the story unfolding here at Project Orphans. This trip isn't about saving or fixing anything. It's about relationship, it's about presence, and it's about learning what it means to love our neighbors across oceans and borders.
When you come to Uganda, oftentimes you think that you're coming here to change someone else's life, but it's your own heart that gets changed the most. The people, the stories, and the strength that you witness stay with you long after you leave. It's a connection that brings dignity and encouragement and a reminder that their stories and their lives matter too.
So important for people to come and experience Project Orphans firsthand because they get to see this mission in action. The people here are just an extension of what we can be part of. We don't have to just be here, but coming here makes it real, and it moves us to act, it moves us to empathy, and it moves us to action.
Hi, my name is Laura Beth Casti. I'm here at Project Orphans because my husband Ethan and I sponsor 3 of our children, and we really wanted to meet them. Meeting our kids was an unforgettable experience, honestly. Just seeing their faces and giving them hugs and, seeing the real person behind all the messages was unbelievable. I would not have traded that experience for anything. So this experience has completely changed my view on sponsorship simply because seeing these kids in person is a wild experience. You see where they live, you see their school, you see really what you're funding, and it's really beyond what you could ever imagine. All these kids have a wonderful opportunity for education and really just developing in every way possible. So being able to see what you bring to the table with a gift is really impactful.
Zirobwe is a rural community where access to medical care has always been out of reach. Over the years, we have worked to meet those urgent needs by opening an outpatient clinic, birthing center, and community medical camps. But we knew more was needed. Now, with the help of generous donors, including some visiting this week, we have opened the first inpatient hospital in the area. For the first time, more than 100,000 people can now receive emergency care, surgery, dental treatment, and inpatient recovery just minutes from home.
I met Brittany with Project Orphans in 2016, and shortly after we started working towards opening their first medical facility. At that time, we really didn't have any healthcare provided in this district. So our focus was to start small and then expand with time. So Cura was the seed that started it all at Project Orphans. Today was a very moving day. It included a lot of special cases, whether it was cardiac or non-cardiac. Obviously, I'm a cardiologist, but the impact that we do here would leave a lasting impression on the community. It is something that isn't necessarily a Band-Aid. As we see patients here, they have follow-up with the local doctors. So by seeing as many as possible in one day, that creates a more comprehensive view of what the community's needs are. So our presence here is of extreme and vital importance.
There are places you visit that you'll never really leave, because once you've walked this path and heard these stories, you carry a piece of it with you. Project Orphans is more than a mission, it's a family, and everyone who comes here becomes part of it.